people in the most deprived parts of England are almost 3 times as likely to lose their lives from an avoidable cause than those in the least deprived areas. With the cost of living soaring and the Resolution Foundation estimating that 1.3 million people will be pushed into poverty as a result of the Chancellor's spring statement, these inequalities will worsen. Why won't he just admit that his government has failed the poorest communities and start doing something about it?
Thursday.
Well, Mr. Speaker, the honourable gentleman acts like health inequalities are something just emerged under this government. They've been long-running health inequalities in this country over decades under successive governments, and it's this government that is putting in record investment and coming with the ideas to deal with them. As ever, Mr. Speaker, the Labour Party, they have no ideas how to deal with the challenges that this country faces.
Jonathan Gillis.
Thank you, Mr. Speaker. Mental health is a serious challenge of our time, and it's totally unacceptable that waiting times, the average number of sessions and the minimum number of sessions is different depending on which part of the country that you live in. And sadly, in Stoke-on-Trent, we've seen recent statistics showing that people taking their own lives are double the national averages, and that's why I'm proud to support a cross-party campaign, the No Time to Wait campaign led by James Starkey, with the backing of the Telegraph and the Royal College of Nursing, to create a provision of mental health nurses in GP surgeries which can make a real difference to those who bravely come forward asking for help. Would my right honourable friend meet with me, members in this House are supportive, and James, to discuss how we can make this possible?
Thursday.
Yes, of course, Mr. Speaker. I'd be delighted to meet with my honourable friend and with others to discuss this campaign. And I know my honourable friend speaks with passion. It's something that he's long campaigned on, and I have had time to look at some of the content of this campaign, but I would certainly be happy to discuss it further.
Dr. Alan Whitehead.
Thank you. Number 6, Mr. Speaker.
Minister.
Thank you very much, Mr. Speaker. Reducing waiting lists and waiting times, exacerbated, of course, by the impact of the pandemic, is a key priority for this government. Southampton, like the rest of the country, will benefit from the detailed actions set out in the elective recovery plan published by my right honourable friend, the Secretary of State, a few months ago. And in addition, as part of Solent Acute Alliance's hospital upgrade programme, the University Hospital Southampton NHS Foundation Trust has received £12.1 million to increase capacity at Southampton General.
Dr. Alan Whitehead.
In speaking with the Hospital Trust in Southampton, which is an excellent provider, they are desperate to get back to elective surgery and non-life-threatening procedures, but find they cannot, because they cannot integrate COVID treatment into general ward activities, and they have a continuing high level of staff sickness, which means that procedures are often undertaken very inefficiently in terms of resources. What assistance can the Minister provide for Southampton University Hospital Trust to enable them to get on the front foot as far as elective procedures and non-life-threatening treatments are concerned in the near future?
Minister.
Well, I'm grateful to the honourable gentleman. He quite rightly pays tribute to the staff at his hospital trust, and I join with him in doing that. We've seen the number of those waiting in his area for an elective procedure or routine operation reduce slightly. There's more to do, but they are making inroads, as he says. I know they want to do more. As we set out in the elective recovery plan, some innovations, such as, for example, surgical hubs, which allow a greater separation between COVID areas or areas where COVID may be present and elective activity, is a key part of that. But if it's helped him, I'm always very happy to meet him to discuss the specifics of his local hospital.
Ian Lavery. Question number 7, sir. Minister.
Thank you, Mr. Speaker. The Government is committed to tackling poor quality housing. In the Social Housing White Paper, we committed to a review of the Decent Home Standard to test whether it is up to date and reflects current needs and expectations. The Levelling Up White Paper sets out a commitment to halve levels of non-decency in all rented homes by 2030, with the biggest improvements in the poorest performing areas. These reforms will have a positive impact on health, and we work closely with the Department of Levelling Up Communities and Housing to support their implementation.
Ian Lavery.
Thanks, Mr. Speaker. The NHS spends a staggering £2.5 billion plus annually treating people with illnesses directly linked to living in cold, damp and dangerous conditions. And as a consequence, severe respiratory disease like asthma, and might I mention mesothelioma and other asbestos-related diseases are on the increase, mainly in the most deprived areas. More and more people are sadly dying, Minister. Can you say how the government's levelling up policy plans to tackle this increasingly urgent health issue?
Minister.
Thank you, Mr. Speaker. And the Honourable Gentleman raises a really important issue, and it's something that we're determined that we'll tackle. Housing is one of the key determinants of health, and a decent home can promote good health and protect from illness and harm. And we know, as the Honourable Gentleman said, that poor housing conditions have serious consequences for mental and physical health, and that's why we're determined, not just through the Levelling Up White Paper, but through the Health Disparities White Paper that will be published later this year, that will set out a bold ambition to reduce the gap in health outcomes and the actions that the government will be taking to address the wider determinants of health, including housing and the impact of poor housing on health.
Lynn Saxby.
Thank you, Mr. Speaker, and I thank my honourable friend for her answer. In North Devon, it's not just the quality of housing that's causing health issues, it's a lack of availability of affordable housing and a complete collapse of the private rental sector, which is delivering mental health issues amongst my constituents, but also means my much-loved North Devon Hospital is struggling to recruit as a local medical services. What steps is the department taking to try and address these concerns?
Minister.
Thank you, Mr. Speaker. And my honourable friend raised an important issue specific to her area and other areas that attract the people who go there for their holidays and perhaps not there on a permanent basis. But we're determined that through our white papers that we address every health inequality, whether it's caused by a population that is a movable population or whether it's a static population in the sort of areas that the honourable gentleman previously talked about.
Bobby Perkins.
Number 8, sir.
Minister.
Thank you, Mr. Speaker. Cancer treatment and diagnosis remained a top priority throughout the pandemic, with 4.4 million urgent referrals during the period and over 1 million people receiving cancer treatment. Thanks to the brilliant work of our NHS staff, first treatments for cancer have been maintained at above 94% of usual levels over the course of the pandemic. However, we do know fewer people came forward, and so we are now seeing record numbers of people coming through the system, with November last year having the highest number of 11,000 cancer referrals per working day.
Bobby Perkins.
Thank you, Mr. Speaker. I asked specifically about Derbyshire. I didn't get an answer in terms of that, but Derbyshire CCGs failed to reach any of the cancer referral targets for the most recent 12 months. And whilst this is a national failure, these shortages are particularly acute in Derbyshire. These failures have tragic consequences. My constituent, Paul Bryan's just 58. He's been attending his surgery for 2 years. He kept getting dismissed. He wasn't tested. And now the prostate cancer that was undiagnosed for all that time has spread to his ribs, to his spine, to his bones, and his diagnosis is terminal. His family are urging the government to show more urgency to improve outcomes so that other families don't have to experience this needless heartbreak that they are. So can the Minister explain to the Bryans why the government rejected the workforce planning amendment to the Health and Care Bill, which could help our NHS get the cancer specialists it needs and prevent other families having this heartbreak like the Bryans?
Well, I'm sorry to hear about the case of the Bryan family, but can I reassure him in Derby and Derbyshire that the start of treatment within 31 days is at 92%, and that's despite record numbers of patients coming forward. And to tackle the very issue that he talks about getting people diagnosed earlier, because that's the key to getting more successful treatment, we are rolling out rapid diagnostic centres across the country so people can access screening and testing much more quickly and much more easily, and we have 159 of those live right now, with more to follow.
Davidson.
Number 9, Mr. Speaker.
Mr. Speaker, personalised healthcare is a key priority in my reform agenda. I recently set out a new ambition that as many as 4 million people benefit from personalised care by 2024, covering everything from social prescribing to personalised support plans. And we are also on track to deliver 200,000 personal health budgets and integrated personal budgets by 2023-24.
Well, thank you, Mr. Speaker. I welcome the Secretary of State's answer. My constituents do still tell me that they are experiencing some delays beyond the NHS guidelines when it comes to diagnosis for special treatment. So what plans does my right honourable friend have to address, in particular, a lack of capacity and a need for capacity in specialty trained doctors and specialist diagnostic equipment to make personalised care a reality?
So state.
My honourable friend is absolutely right to raise the importance of the workforce and medical equipment. He will be, I'm sure, reassured to know that the NHS today has more doctors and nurses working for it than ever before, with more in training than ever before, and we're investing record amounts in capital for new medical equipment, including investment in some 160 new community diagnostic centres, which will all include the latest state-of-the-art diagnostic equipment.
Adam Kaiser.
Number 10, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. NHS England has several bespoke services for veterans. This includes Up Courage, the Veterans Mental Health and Wellbeing Service, which provides a complete mental health care pathway for veterans. And veterans can benefit from personalised care plans, ensuring they can access support and treatment both in and out of hours. And as part of the care and support available to veterans, Up Courage works with military charities and local organisations to provide health with wider health and wellbeing needs, including drug and alcohol addiction.
Thank you, Mr. Speaker. My constituency of Airdrie and Shotts has a long military history, with many previously serving in the armed forces. When I meet veterans from my constituency, we often discuss the mental health of veterans. And the war in Ukraine will undoubtedly have an immediate and lasting impact on the mental health of veterans, as they may be reminded of their experiences of war. So to help support our veterans, will the Department come forward with a package of emergency funding for armed forces mental health charities?
Minister.
Well, the Honourable Lady raises a very good question, and last year we committed an additional £2.7 million to further expand Up Courage following the recent events in Afghanistan. And NHS England has put in place several bespoke services and initiatives to meet the needs of our armed forces community. In addition to Up Courage, there is also the Veterans Trauma Network, the Veterans Prosthetic Panel and the Veteran GP Accreditation Scheme. But of course, with the ongoing events in Ukraine, of course, we will keep everything under review, and I'm very happy to meet with her to discuss further what may be required in this area.
We now come to Shadow Minister Dr. Rosanna Allen-Carr.
Thank you very much, Mr. Speaker. Our veterans have risked their lives for our country and deserve excellent mental health support. We must go even further. From the military frontline to frontline workers who have kept us safe, everyone deserves proper mental health provision. People have stepped up to protect our country and save lives during the pandemic. So is it any wonder then that teachers and NHS staff are so furious with the comments made by the member for Lichfield that they would go back to the staff room and have a quiet drink as a way to justify the indefensible actions of the Prime Minister? What does this say about the effect of mental health on our frontline staff? And will the Minister please condemn these comments and apologise for the hurt caused by these remarks?
Minister.
I'm very happy to say that we, of course, thank very much all of the staff that have been on the front line, whether they're veterans, whether they're teachers, involved in everything that kept us going throughout the pandemic. And, of course, the stresses and strains and the impact on mental health is something that we're very much aware of. There is additional support for mental health, and there will continue to be additional support with young people's mental health, with adult mental health. But of course, that's one of the reasons why we launched a call for evidence last week to inform a new 10-year cross-department mental health vision. And I would urge everybody actually to input into that process before it closes on the 5th of July.
Mr. Blackman.
11, please.
Thank you very much, Mr. Speaker. The workforce is the heart of our NHS, and I join with my honourable friend, and indeed I know with opposition members as well, in paying tribute and putting on record our thanks to those who work in the NHS. In the short term, the NHS has well-established processes to ensure the health service has the right number of staff with the right skills, alongside, of course, our investment in workforce expansion, including delivering 50,000 more nurses over the course of this Parliament. For the longer term, we have commissioned Health Education England to set out key drivers of workforce supply and demand. They're due to report this spring, and building on this, my right honourable friend, the Secretary of State, commissioned NHS England to develop a long-term workforce framework. We will share the conclusions in due course.
Kirsty Blackman.
Thank you very much. The anti-immigration hostile environment rhetoric and actions of this government means that it's having a significant impact on our NHS workforce, both in encouraging or not encouraging people to come here to work in our NHS, but also in discouraging current staff from staying here. The Health and Social Care Committee recommended that a national policy framework on migration to support national and local workforce planning be brought in. When will the government implement this recommendation?
Well, I'm very grateful to the Honourable Lady for her question. We are clear, and always have been clear, in how much we value the huge contribution that overseas workers in our NHS play in keeping our health service up and running and in delivering first-class care every day. There are three strands to our approach to building our workforce and increasing our workforce. One of them is increasing the numbers of people training in this country. A second is increasing retention, and a third is that workforce that comes from overseas and is incredibly welcome here. And I have to say that the number of people coming from countries outside of the EU into our NHS workforce has increased.
Anne-Marie Morris.
Thank you, Mr. Speaker. The Minister will be aware that the particular challenge for rural areas of developing a workforce plan are something which I have highlighted on a number of occasions. Indeed, the last report from the APPG on rural health and social care put forward 10 recommendations which included how we might address the workforce planning issue in rural areas. Could the Minister advise me what steps he's taken to put in hand any of those recommendations to improve the plight of those living in rural areas?
Minister.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend, who I know takes a close interest in this issue. She and I have discussed it on a number of occasions. And she's right to highlight the challenges that some more remote or rural communities can face in securing the workforce they need to meet their communities' needs. That is one of the things that I know that HEE work and subsequent workforce framework will be looking at across the whole range of geographies and the challenges faced by different geographies.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. The Scottish Government has recently bought Carrick Glen, a private healthcare hospital, in order for it to become part of the national network of treatment centres, which, once fully operational, will deliver capacity for over 40,000 additional surgeries and procedures each year. In contrast, the UK Government has taken the path of further privatisation of the NHS. So what recent assessment has the Minister made of the impact on workforce of further privatisation of NHS England?
Minister. Thank you, Mr. Speaker. Well, I'm grateful to the honourable gentleman. Had we been going further down the route of privatisation, perhaps the honourable gentleman's question might have had a little more resonance. What we have done in the NHS in England is investing in our workforce, investing in our national health service, while, of course, working closely with the independent sector to maximise the use of their capacity in parallel to make sure we bring down waiting lists and waiting times.
We now come to topicals. Maurice Robertson.
Topical question number one, Mr. Speaker.
Stay.
Thank you, Mr. Speaker. Our healthcare system is standing at a crossroads, and sooner or later we will have to make a choice between endlessly going back to the taxpayer to ask for more money and reforming the way in which we do healthcare in our country. Last month, I unveiled an ambitious new programme for reform, setting out how we are going to prioritise prevention, offer more personalised care, deliver improvements in performance and back the people making the difference in the NHS. The objective of this agenda, Mr. Speaker, is simple: to bring about the biggest transfer of power and funding in decades from our ever-expanding state to individuals, their families and their communities.
Robertson.
Thank you, Mr. Speaker. In Gloucestershire hospitals, 30% of patients do not medically need to be in hospital awaiting for discharge. That figure is twice the national average. Will one of the ministers contact the relevant people in the health service in Gloucestershire to ask them ways in which the government could help them to reduce that figure? Because as it stands, lives are being put at risk.
Mr. Speaker, my honourable friend is right to raise this, and We are already in contact with the acute trust in Gloucestershire and some of the other trusts that are finding delayed discharge a particular challenge. My honourable friend will know that because of the pandemic, what has been a long-term challenge has become much more acute, not least because of the lost beds due to infection protection control and staff absences, both in healthcare and in social care. Our delayed discharge task force is making a difference. Numbers are coming down overall, but we will be working with Gloucestershire.
Secretary of State West Street.
Thank you, Mr. Speaker. Why does the Health Secretary think he has any licence to lecture the British people on their moral duty to pay taxes when he spent so many years avoiding his own?
Mr. Speaker, we want.
I'm not quite sure it's relevant to the question of topicals.
I'm very happy to answer if you allow me, because the honourable gentleman, he could have asked me a question on anything to do with health and care, anything he wanted, but instead he chooses to talk about my personal affairs before public life. That was his choice. He could have asked me, Mr. Speaker, he could have asked me about the COVID backlogs that he pretends that he cares so much about. He could have asked me about how, perhaps given me suggestions.
Order. Secretary of State, just say, I've got it. There are questions and your responsibilities. No, we can have another try. West Street.
Thank you, Mr. Speaker. I'd just say to the Secretary of State, be careful what you wish for. I hope he will at least reply to the letter I sent him last Thursday. I'll place a copy in the library of the House. He's been stonewalling journalist questions, but since he says he wants to talk about the government's record, let me ask him about that instead. Because we went into the pandemic with NHS waiting lists already at 4.5 million. We went into the pandemic with NHS staff shortages of 100,000. We went into the pandemic with social care staffing vacancies of 112,000. So it isn't just the case the Tories didn't fix the roof while the sun was shining. They dismantled the roof, removed the floorboards, and now they have no plan to fix it. So where is the Secretary of State's plan to fix the NHS crisis?
Once again, I'll remind that topicals are short and punchy, not lengthy statements rather than a question. Now, I just want to say there's a lot of backbenchers on both sides who deserve to get in, who want to raise constituency matters. Please, let's give them time. I don't want a lengthy fallout, and they are health questions. Secretary of State.
Mr. Speaker, you've been very generous to the honourable gentleman, but another try you gave, but another failure in asking a question. Again, he's not talking about the serious issues, and it shows once again that he will play petty party politics. Labour has no plan for the challenges that this country faces.
Can I just reassure the Secretary of State for Health? I wasn't being generous. The actual Shadow Secretary of State did have 2 questions, so I've not been generous in any shape, way or form. Mark Fletcher.
Mr. Speaker, we've all seen the disturbing scenes in Shanghai recently, and does my right honourable friend agree that this shows how dangerous a zero-COVID strategy is, and that we were right to open up this country and to rely on our vaccines as the safest way out of the COVID situation?
Mr. Speaker, like many across the House, I've been deeply disturbed by the reports that we've all seen from Shanghai, and my thoughts are with the people that are affected. It does show what dangerous fallacy this whole idea of zero COVID was, and it does also show the fact that we are the most open country in Europe, that we've got the big decisions right. We didn't listen to the party opposite when they said we shouldn't open up in the summer. We didn't listen to the party opposite when they said in the winter, again, calling for restrictions. We are showing the world in how to live with COVID.
Thank you, Mr. Speaker. My constituents are being forced onto private and unaffordable dental plans or wait up to 5 years to see an NHS dentist. The situation is getting worse and worse. So I've met with the groundbreaking Hull and York Medical School to see if they can assist with training a future generation of dentists. They are keen to help. So what is the Minister doing to work with medical schools?
Well, we're going to get others in.
I thank the Honourable Lady for her question. We have met to discuss this previously. I'm happy to discuss with Health Education England to see if one of their centres for dental development could be suitable for her constituency.
Peter Bone.
In 2019, Kettering General Hospital, which serves my constituency, was promised £46 million for a major upgrade. 3 years later, the hospital still hasn't got the money. Secretary of State, Can you go out and buy a very, very, very big pair of scissors, cut through the red tape and get it sorted?
Well, I'm grateful to my honourable friend. No one, with possibly the exception of the honourable member for Kettering, is more passionate about seeing the improvements at his local hospital delivered, and I had the pleasure of visiting. The £46 million, he will know, was allocated originally for an urgent treatment centre. The hospital asked that that be changed, and it folded in with the overall programme. They have yet to submit a business case for the enabling works. When they do, I will ensure it is expedited.
Lloyd.
Thank you, Mr. Speaker. The gap in life expectancy between people living in the richest and the poorest areas is once again growing. That affects my constituents directly. I've heard nothing today that tells me what the Secretary of State is going to do to narrow that gap. So, Secretary of State, what will you do to protect my constituents?
Mr. Speaker, the honourable gentleman knows that I know his constituency well. It's my birthplace, and he may know also, just a couple of months ago, I visited his constituency and I met with members of the local community at the Deeplish Community Centre to talk about exactly what he's rightly raised today, the importance of tackling inequalities in Rochdale and beyond, and that will be set out, our plans, in our upcoming health disparities white paper.
James Sunderland.
Mr. Speaker, thank you. The CAS Review interim report found that to date there's a profound lack of evidence on the best approach to treat gender dysphoria in children. Does my right honourable friend share my concern that in spite of this, the NHS insists on making a child's expressed gender identity the start point for treatment, and also my surprise that the NHS has chosen so far not to track patient outcomes, particularly for under 18s?
Mr. Speaker, I do share my honourable friend's concerns, and that is why the NHS commissioned this review from one of our top paediatricians. It is already clear to me from her interim findings and from the evidence, other evidence that I've seen, that the NHS services in this area are too narrow, they are overly affirmative, and in fact they're bordering on ideological. And that is why in this emerging area, of course, we need to be absolutely sensitive, but we need to make sure that there is holistic care that's provided, that there's not a one-way street, and that all medical interventions are based on the best clinical evidence.
Bill Rivera.
Thank you, Mr. Speaker. Since February 2020, my local borough of Lambeth has seen a 14% drop in dementia diagnosis. Now, that just means that people aren't getting the support that comes with diagnosis. We also know that so far none of the announced £8 billion backlog funding has been dedicated to addressing the stagnation of diagnosis rates. So can the Secretary of State explain to us exactly what they're going to do to make sure that people are getting diagnosed on time?
The Honourable Lady raises a very important question. We want a society where every person with dementia, their families and carers receive high-quality care, compassionate care from diagnosis through to end of life. We have provided £17 million this financial year to NHS E&I to increase the number of diagnoses. And this funding was spent in a range of ways, including investing in workforce to increase capacity in memory assessment services.
Speaker, the Secretary of State will have read the scandal exposed in the Sunday Times this weekend that 6 babies are being born every month after being exposed to sodium valproate, which has been known for many years to cause disabilities. Last year, the government consulted on putting warning labels on valproate. Is it not time to go much further and ban the prescription of sodium valproate to epileptic pregnant mothers?
Mr. Speaker, my right honourable friend is right to raise this, and many of us would have seen the recent reports on this, especially from the families affected. It is right that we reconsider this and that we make sure that whether it's sodium valproate or any other medicines, that they are only given in the clinically appropriate settings.
Toby Perkins.
Thank you, Mr. Speaker. The Secretary of State is right that there's many important health matters that we all want to get to the bottom of, and we don't want his, as what he described, personal affairs to get in the way of that. So would he, in order to ensure this House concentrates entirely on those matters, welcome the HMRC investigating whether he was claiming non-dom status on a solely...
Order. Let's move on. What a waste of a question. Jenna Davidson.
Thank you, Mr. Speaker.
Speaker, I'll try not to make this one a waste. I was very grateful to the Minister for meeting me to discuss my ongoing campaign to restore the A&E to Bishop Auckland Hospital. Many of my constituents face huge drives to get to Darlington or Durham, and given that swift treatment can be a significant factor in outcomes for a number of conditions like strokes and heart attacks, would he agree with me that having A&E services spread geographically rather than just in strong population centres is an essential part of keeping our community safe?
Hear, hear. Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend. I did indeed have a very positive and constructive meeting with her. It's absolutely right that we have access geographically spread to A&E services, but these decisions are quite rightly taken by clinical commissioners on the basis of clinical evidence. But I know she will continue fighting the corner for the reopening of her local A&E with tenacity and passion.
Mr. Speaker, the 10-year cancer plan the Secretary of State has announced is a key opportunity to ensure that future services are designed with the patient at its core, especially for those living with cancer. What steps is his department taking to engage with underrepresented groups in the development of the 10-year cancer plan? And will you agree to meet with Macmillan Cancer Support to discuss how they can support in this key area?
Mr. Speaker, I would pleased to have the meeting that the Honourable Lady has suggested, and she should know the 10-year cancer plan. We've just closed the consultation. There's been a fantastic response to the consultation. She may also have seen the announcement we made today around the lung cancer health checks, and it's with improvements like that we intend to do a lot more.
One of the best ways to maximise NHS capacity is to increase people's access to GP appointments and treatments like mental health services and physiotherapy in their own community. So would the Minister join me in backing our bid for a new health centre in Eastleigh and in calling on Nottinghamshire's Clinical Commissioning Group to prioritise funds for this vital service?
I thank the Honourable Lady for her question. I did an excellent visit to the surgery in Eastleigh, and I look forward to the business case being submitted so we can look at it further. She's quite right. Investing in primary care does a huge amount to support the health of the local community.
Thank you very much, Mr. Speaker. A survey by the charity STEM4 has found that 95% of GPs believe CAMS services are in crisis, with children and young people waiting up to 2 years for treatment after referral. Will the Secretary of State stop treating children as an afterthought and act to provide open access mental health hubs for young people in every community to put an end to these agonising waits?
The Honourable Lady raised a very important point, and I know that children's mental health services are treating more young people than ever. However, the demand has quadrupled since the pandemic, and we know that's why we've invested £79 million in these services, and by 2023-24 an extra 345,000 more young people will be accessing support. I mentioned the call for evidence. I think it is very important that we work through our vision for our 10-year plan. We're also introducing mental health support teams in schools, which will help, plus access to community and mental health hubs, and more young people access to eating disorder services, but there's a lot of work ongoing.
Thank you, Mr. Speaker. I know from discussions with constituents that needle phobias are a real thing. Can my right honourable friend therefore tell the House what support the government is giving to intranasal vaccine delivery systems to ensure that the maximum number of people take up the vaccine?
Thank you, Mr. Speaker. The Department for Health and Social Care commissions research through the National Institute for Health and Care Research, which the UK Research and Innovation has co-funded in the Imperial College London study worth £580,000, looking specifically at the safety and effectiveness of 2 COVID-19 vaccines administered via the respiratory tract. This study is ongoing, but in later stages of the Phase 1 clinical trial, and results will be made public in due course and following peer review.
Thank you, Mr. Speaker. Those doing social care often work long hours as a real lifeline for the most vulnerable. Will the Minister act to ensure those in social care are paid properly and paid a real living wage, as Citizens UK is campaigning for?
I thank the honourable gentleman. Actually, according to Skills for Care data from 2020-21, the majority of care workers were paid above the national living wage in that year. Most care workers are employed by private sector providers who pay their terms and conditions. However, we are committed, and we have committed £1.36 billion to Market Sustainability and Fair Cost of Care Fund, which will support local authorities to move towards paying providers a fair cost of care, which we hope will lead to better sustainability and better staff.
Thank you, Mr. Speaker. At Prime Minister's Questions, I have raised a local campaign for a specialist menopause clinic in Devon. I'm pleased the Minister has agreed to meet with me. Will my right honourable friend encourage local NHS leaders to fund specialist menopause services?
I thank my honourable friend for his question. The Government recognises that menopause services are needed to improve, which is why menopause is a priority area in our women's health strategy. We also recognise that it's often best provided in primary care, but some women do need some specialist services, and we are looking at this in our women's health strategy and also the menopause task force as well.
Kate Osborne.
Mr. Speaker, in December last year, the Department of Health and Social Care promised 3 urgent actions to tackle the gender health gap: the appointment of a Women's Health Ambassador, legislation to ban hymenoplasty, and that the Women's Health Strategy for England would be published in the spring of 2022. So can I ask the Minister, when are these vital actions actually going to happen?
I can let the Honourable Lady now know that interviews have taken place for the Women's Health Ambassador. We're expecting an announcement on the appointment any day now, and we will be publishing the Women's Health Strategy in the coming weeks.
Sir David Evans.
Mr. Speaker, can I welcome all my right honourable friend is doing to address health inequalities? However, could I ask him to look carefully at public health funding for my borough of Bexley, whereas we're seriously underfunded compared to similar boroughs in London?
I'm very pleased to meet with my honourable friend and to discuss that further, and I'm sure also he will welcome the publication of the upcoming Health Disparities White Paper.
Final question, Kim Blanbeater.
Thank you, Mr. Speaker. In a recent survey by Carers UK, almost half of unpaid carers said that they are currently unable to manage their monthly energy bills and expenses, and any further increases will negatively affect their own physical and mental health or that of the person they care for. So what steps are being taken, along with the Secretary of State for Work and Pensions, to support these hard-working, exhausted, unpaid carers with the cost of living?
I thank the Honourable Lady for her question, and of course we have a great deal of gratitude for every unpaid carer. Around 360,000 carer households on universal credit can receive an additional £2,000 a year through the carer element. The weekly rate of carers allowance increased to £69.70 in April 2022, and we've also had a real terms expenditure on carers allowances forecasted to increase by around £1.3 billion. In addition, there are a big focus in our reforms and our white paper to focus on what more we need to do to support unpaid carers.
We now come to the statements, in which I will call the Home Secretary. Home Secretary Priti Patel.
Thank you, Mr. Speaker. With permission, Mr. Speaker, I'd like to make a statement on the United Kingdom's approach to the global migration challenge. The United Kingdom has a long and proud history of offering sanctuary to refugees. In recent years alone, we have welcomed more than 185,000 people through safe and legal routes, including from Syria, Hong Kong, Afghanistan, and more recently, Ukraine. In addition, we have welcomed more than 40,000 people in recent years through our refugee family reunion routes. This government has done more than any other in recent history to support those fleeing persecution, conflict or instability. But we cannot focus our support on those who need it most or effectively control our borders without tackling illegal migration, which, Mr. Speaker, is facilitated by people smugglers, serious organised criminals that profit from human misery, who do not care about people drowning in the Channel or suffocating in the back of containers. We must break their lethal and evil business model by removing the demand for their repugnant activities. This type of illegal migration puts unsustainable pressures on our public services and local communities. Every day, the broken asylum system costs the taxpayer almost £5 million in hotel accommodation alone. The cost of the asylum system is the highest in over 2 decades at over £1.5 billion. And as the Prime Minister, Mr. Speaker, said last week, we cannot sustain a parallel illegal system. Our compassion may be infinite, but our capacity to help people is not. But this is why the new plan for immigration and its legislative vehicle, the National Anti-Borders Bill, are so vital. And once again, I urge honourable members, but also members in the other place, to follow this elected House in backing the bill. At the heart of this government's approach is a simple principle, Mr. Speaker: fairness. Access to the UK's asylum system should be based on need, not on the ability to pay people smugglers. Mr. Speaker, more than 80 million people around the world are displaced. Others are on the move because they want a better life. There is a global migration crisis that demands innovative and international solutions, and this government is taking firm action. When I published the new plan for immigration back in March last year, we set out 3 very clear objectives: to increase the fairness and efficacy of our system so that we can better protect and support those in genuine need of asylum; to deter illegal and dangerous routes of entry to the UK, thereby breaking the business model of criminal smuggling networks and protecting the lives of those they endanger; and, Mr. Speaker, to remove more easily from the UK those with no right to be here. The Ministry of Defence has taken command of small boat operations in the Channel. Every small boat incident will be investigated to determine who piloted the boat and could therefore be liable for prosecution. These reforms are a truly cross-government effort, including the Home Office, the MOD, the Crown Prosecution Service, Border Force and the Ministry of Justice. A nationwide dispersal system will be introduced so that asylum pressures are more equally spread across local authorities. Currently, 53% of local authorities in England, Scotland and Wales do not accommodate asylum seekers under the dispersal system. It is simply unfair that a national burden should be felt disproportionately by certain areas of the country. For the first time, Mr. Speaker, the government is building asylum reception centres to end the practice of housing asylum seekers in expensive hotels. A new reception centre in Linton upon Ouse in North Yorkshire will open shortly. Far from being outlandish, as some of the opposition have commented, asylum reception centres are already operational in safe EU countries such as Greece, Mr. Speaker. And, Mr. Speaker, they are funded by the EU. And just last week, I signed a new world-leading migration and economic development partnership with Rwanda. Under this partnership, those who travel to the UK by illegal and dangerous routes, including by small boats across the Channel, may be relocated to Rwanda, where they will have their asylum claims considered. Those in need of protection will be given up to 5 years of support, including education and employment training, help with integration, accommodation, healthcare, so that they can thrive there, Mr. Speaker. The UK is supporting this investment in Rwanda over 5 years, boosting the Rwandan economy and increasing the opportunities of people living there, further cementing the trading and diplomatic relationship between our countries. Mr. Speaker, this is a bespoke international agreement reached last week with Rwanda. I came to Parliament as soon as was reasonably practical following the conclusion of that agreement. This agreement is comparable with all our domestic and international legal obligations. Rwanda is a state party to the 1951 United Nations Refugee Convention and the 7 core United Nations Human Rights Convention, and has a strong system for refugee resettlement. The United Nations has used Rwanda for several years to relocate refugees, Mr. Speaker. And, of course, Mr. Speaker, it was the European Union who first funded this. This agreement deals a major blow to the people smugglers and their evil trade in human cargo. Everyone who is considered for relocation will be screened and interviewed, including an age assessment, and have access to legal services. Mr Speaker, in relation to accounting officer advice, contrary to reports in the newspapers, the Permanent Secretary did not oppose this agreement nor assert that it is poor value for money. Rather, he stated in his role as accounting officer that the policy is regular, proper and feasible, but there is not currently sufficient evidence to demonstrate value for money. It is the job of ministers to take decisions, Mr Speaker, and it is the job of ministers, Mr